I am basically taking this channel and I am going to make it so that you're going to be able to know every single trap that is in maternity care, from making mistakes in your birth plan, making mistakes when it comes to hiring your care provider, making mistakes when talking to your partner about what you want in your birth, the mistakes that you can make that can derail your natural birth by just choosing the wrong environment for you, making the mistakes in your mindset of how you're thinking about your birth and how you're coming to it and how you're planning for it and the fears that come up. I'm also talking about the natural birth traps, the cesarean traps, the induction traps, the VBAC traps. Everything that I've seen over the last 10 years inside the birth community, I'm giving it all to you. Why? Because I'd like you to start avoiding these traps. I'd like you to actually be able to have your empowered birth. And I see this all the time in the mom groups. You come in, you ask these questions on, should I have my waters broken? Or should I go to the hospital at the time that my doctor says like 4 centimeters and I need to be in the hospital for this because I'm attempting a VBAC? All of these things can lead you right down the path you don't want to go. I see it over and over and over again. Like, I cannot stress this enough. The reason why you want to be paying attention, and make sure that you're even taking notes if you need to, and watch these videos over and over again until you get it, is because if you pay attention to what I'm going to show you, you will avoid some of the most common things that derail natural birth plans. You will avoid those things that trick moms into a cesarean. You will not be tricked. You will see it coming. You will recognize that your care provider is trying to push you down that road, and you'll be strong enough to say, yeah, no, we're not going down that road. No, sorry, not happening. And your care provider might be frustrated and be like, damn it, like, this is what we do. And they're going to be scared, but you won't be. You won't start to doubt yourself. You won't think, maybe I'm making a big deal out of nothing. Maybe I really should do this thing. I mean, everybody else does it, so it must be what's recommended and what's routine. And routine means that it's something that's been clinically proven. No, it has not. Because the concept of evidence-based care didn't start coming out for maternity care until about the 80s and 90s. Before that, people were just doing things because it was just the way that they always were done. That's why if you go and watch Call the Midwife, they're doing enemas. Like, first of all, you don't need an enema to give birth, but that's what they would do. And another one, of course, a big one, especially from the 80s and down to like the 70s and previously, is the episiotomy. There was a time when everybody had an episiotomy. So your mother possibly had an episiotomy, and it was just done. And then afterwards, as a bonus, you would get the husband stitch, and they would stitch you up tighter than you were when you first gave birth. So then your opening to your vagina would be a lot smaller. So when people say, oh, well, you know, this is how it's always been done, so that's the safest way. No. In fact, there's a book that I would really like you to pick up at some point. The Thinking Woman's Guide to a Better Birth. This one actually outlines the evidence for a lot of the common procedures, and it's listed from most common to least common in maternity care. And she talks a lot in this book about how a lot of the things that are being done don't actually support the evidence for physiological birth. And if you would like a newer version of this, then Reclaiming Childbirth as a Rite of Passage is my absolute favorite, because not only does it talk about the evidence and lack thereof for a lot of maternity care practices, but it also talks about how the physiological birth process works and the historical context. So you may have noticed that in a lot of my teaching, I go into historical context. And the reason for that is because I really want you to understand that the way that you're thinking about this is based in fear. It's based on your cultural and societal upbringing. It's based on the fact that you've been indoctrinated into a system. We all have. In fact, I had seen it for years, but even I fell into these traps. So these are things that I fell into, that my friends fell into, that my clients have fallen into, that I've seen in the mom groups. And I can usually see these things coming a mile away. Like I will go into a mom group and I will see questions asked, or I will see a scenario coming up and I'll be like, oh dear, if they don't follow what I'm about to tell them and they continue to do what they're doing, they are going on a one-way trip right into the OR. And sure enough, if they don't listen and they go into their birth, I guarantee like a couple of days later or even a week later or however long it is until they go into labor or get induced or get pushed into a C-section, they will tell me, or they will tell the group, well, I ended up having a C-section. How do I recover from the C-section? So this is your warning right now that if you don't pay attention, you're going to end up in a C-section. If you don't start paying attention to these natural birth traps, these cesarean traps, these labor traps, if you don't take this seriously, you are going to fall into one of those traps. You're going to stay in your fear. You're going to have that anxiety. You're going to doubt yourself. And then that is going to allow the system to push you right into the kind of birth you don't want. So Rebecca, of course, hadn't known any better. She was 18 years old with her first baby. She was pushed into an induction. And then sure enough, she ended up with a C-section. And Jenny, who was also pushed into an induction because she was high risk. And because she was actually high risk, she did have chronic issues, but those same issues were around when she went into labor with her second as well. She still had chronic high blood pressure. She had gestational diabetes this time. But you know what the difference was? The difference was that Jenny knew which traps to avoid. Jenny had her mindset strong. She was out of her fear. So she was able to advocate for herself. And Rebecca was able to have a home birth after 2 previous cesareans because she learned how to advocate for herself. She could have easily been talked out of that home birth by her care provider if her care provider had known about it. But she could have even had her confidence undermined by the fact that she was attempting a VBAC after 2 cesareans if she had not learned what I teach in Your Empowered Birth, which is available on my website. You just go to empoweringmomsbirth.com/book. So the thing is that these cesarean traps are numerous. There are so many of them. And I am basically going to be teaching you at least 5 each week until we're going through that list. And there will probably be more. There is always more. There's always things that I'm finding. And if you yourself were found that you found out that you were in a trap, that you're like, you know, I think I got tricked into this and now I can see it. Now I can actually pull back the curtain and I can recognize what was going on. You can always send me a message at carly@empoweringmomsbirth.com and let me know, because I'm also pulling from a lot of what I read in the mom groups. I'm pulling from what I read in the Empowered Birth community. So I want you to utilize this. I want you to use this community in the chat and the social media channels to really get that message out there and say, hey, this happened to me and I'm not okay with it. And this is what I learned from that. And this is how I changed it. If you've already had an empowered birth, I want to hear your stories, because I've got some of you who have told me the stories, and then the rest, some moms have not told me the stories, but I know that they've had an empowered birth, because this system works. If you follow this system, it will work. So what is the empowered birth system really quickly? It's the right mindset, the right education, the right environment, the right facilitators, and the right support. And the right mindset and the right support are the 2 bookends of the whole system that allow you to have the other 3. You need to have all 5 optimized. It's like a 5-pointed star. If you don't have all 5 points, it's not going to work. And you're going to start to doubt yourself. You're going to fall into those traps. You're not going to see them coming, or you're going to ignore the red flags. This is another one where you see the trap coming, you know what's going to happen, but for whatever reason, you cannot seem to take your foot off that gas pedal because you're just too scared. And you're like, better the devil I know than the devil I don't. And then you just go into it, and then you fall into that, because it's easier to fall into that trap than it is to pull yourself out of it, because you don't have the tools to do that. That's why I teach you the tools on how to get out of these traps. And again, you can always go and get my book, Your Empowered Birth. It's on my website. You just go to empoweringmomsbirth.com/book, put your name and your email in, and then it will actually deliver a copy of this ebook to you in your inbox. You will be able to get it through your email. And I also send additional tips as well through this email list. So you want to be on that. You want to be reading this book, because this is the overview of the entire system. This will help you get the birth you want without having to fight, without having to beg, without having to compromise. And this is especially true if you are having a VBAC or you are determined to not have a C-section in the first place. Because oftentimes the best way to avoid a repeat C-section is to never have a C-section in the first place. But we have a 1 in 3 cesarean rate. And the reason for that is because people fall into these natural birth traps that lead to cesareans. And then they fall into cesarean traps on top of that. So what are we talking about today? We are talking about the 5 most common practices that people fall into these traps. So these are the things that are expected oftentimes as a natural birth trap when you're attempting a natural birth. And these things are even more prevalent if you have already had 1 or more cesareans. In fact, some of these things are actual VBAC traps at the same time. So I listed 5 that I'm going to be telling you today. So what is the first one? Okay, so number 1 on the list is also going to be a natural birth trap. I've talked about this before. Continuous electronic fetal monitoring. Now, with a first birth, you can kind of get away with not being on the monitor. With a VBAC, however, a lot of VBAC tolerant care providers will say you need to be on the monitor the whole time. What this does is this restricts your movement. This keeps you in the bed. This also allows the nurse to use the strip as a determining factor as to whether or not they need to do a C-section. And here's the real kicker, is that they invented this specifically to try to figure out if they could reduce the adverse outcomes. So like if moms happened to be in the hospital and they had this monitor, it was supposed to reduce the chances of cerebral palsy. It does not. In fact, again, if you read this book, The Thinking Woman's Guide to a Better Birth, this one actually goes into the details of how little the continuous electronic fetal monitor contributes to actually saving lives and saving your baby's life and detecting problems. Instead, what it does is it gets a lot of false positives, and these false positives then lead people to say, oh, well, heart rate's decelerating, we need to do a C-section. And chances are that wasn't actually necessary. But because they have the machine that goes ping, and because the machine is now being more trusted than your instinct, they've now pushed you into a C-section. So if you can avoid it, you tell them, I do not want the electronic fetal monitor, because that allows you to have more control. If they have to use the Doppler to get a heart rate, then they're not going to be using it as often, which means you have more freedom to be like, yeah, I don't want anybody to touch me right now. And you could literally be pushing a baby out like Jenny did in the hospital, where the nurse was like, I want to get you on the monitor. I want to be able to check the baby's heart. And it's like, lady, the baby is coming. You are not going to be able to find a heart rate at all, because the baby is in the birth canal. This is another thing, is that fetal monitor is not going to be very effective if the baby is already moving into position or if the baby is very active. And they can lose that heart rate because it's just not in the right position. So the next one, of course, with that is that they will usually say, oh, well, we can't get a good rate. We can't get a good reading, so we need to do an internal monitor. Now you're really stuck. And they do this more with VBAC. So now you've got the internal monitor and your baby is now literally got a wire screwed into their heads. You think that that's not a problem for that poor little baby? Probably a real big problem. Not only that, but now they've also had to do the next intervention that I'm going to get into, which is breaking your water. So when they break your bag of waters, do you know what they're actually doing? They're removing that cushion that is allowing your uterus to squeeze. Instead of squeezing on that water balloon, it's now squeezing on your baby. So if they're squeezing on the baby is maybe not able to get into the right position. Not only that, it's more painful because instead of a nice squishy water balloon on your cervix, you now have a bowling ball. So your baby can't get into the right position. You've got a bowling ball on your cervix. You're in a lot more pain. And because your waters have now been broken artificially by the care provider, what happens is you're now on a clock. And they're still doing vaginal exams. And these vaginal exams can lead to you ending up having an infection. And then they'll say, well, your waters have been broken for about 12 hours and nothing seems to be progressing. You actually seem to be having a swollen cervix, so we have to do a C-section. Don't do this. Seriously, don't do this. Again, there is more information inside this book, The Thinking Woman's Guide to a Better Birth, about waters releasing. And Rachel Reed talks about this inside Reclaiming Childbirth as a Rite of Passage. So I basically believe that if your waters were meant to break, they would break on their own. My children, when I'm birthing, my waters don't release until right before crowning. And there's probably a reason for that. And it probably has a lot to do with how the biofeedback needs to be. Because if your baby is being squished by those contractions, and those contractions are really strong, that can also cut off oxygen supply. Another thing is that if they're breaking your waters artificially, here's one of the main dangers that can happen. Your membranes might be also attached to the placenta, or they might accidentally get the placenta or the membranes with the placenta, and then you're bleeding out. Or your baby might be high up and the cord slips down, which would otherwise have been fine if you had been waiting until the last possible minute to birth your baby, and then suddenly your water's released. So cord slips down, that's called a cord prolapse. That is a problem because then when the baby comes down, it can also pinch the cord. The cord is what allows your baby to breathe. It is not their neck. So when people say, well, the cord was around the baby's neck, the reason for that is actually nature's design. They want the cord to be wrapped around the baby because it's less likely that when your water's released that the cord is going to slip or that the cord is going to become compressed. But again, this is something that our medical system does not really understand about physiological birth. They've been doing this routine intervention for so long, they can't see it. They don't see physiological birth. And Rachel Reed talks about this in her blog, Midwife Thinking, in a post about the nuchal cord being the perfect scapegoat. And she also talks about what you want to do to keep your membranes intact. Like she talks about that as well, about in defense of the amniotic sac. So these two blog posts alone gave me a lot of information, and I'm very grateful that I learned ahead of time, do not let them break your water, because this is a huge cesarean trap. The second they break your waters, now you're on the clock, now they're doing vaginal exams, and maybe you weren't actually in active labor, but your cervix was just dilated and it may not have been time. But now you've kind of put a dent in this, because once you rupture that bag artificially, you've lost that bag of water. You've lost that cushion. You've lost that ability for your baby to turn. You've lost that ability for your baby to stay in safer. And this is another reason why when I was in my home birth with my daughter, my waters were intact. So it wasn't a big deal when my labor stalled for 16 hours after a 24-hour labor. And the midwife had basically said to me, if things keep going this way, we're going to have to break your waters. I'm like, you're not breaking my waters. Like, nobody is doing anything that is going to compromise this. Because if my labor stops, but the bag of waters is still intact, then that just gives me more time. But if I break that bag of waters, now I'm on a clock. Now it's imperative that contractions start within at least a few days, because if it doesn't, that can be a real problem. So again, if you're trying to avoid a cesarean, you do not want them to break your waters. And if you're worried that they might try to break your waters, here's the most easy way to stop them from breaking your waters. You don't let them do a vaginal exam. You don't let them anywhere near your cervix, because if they can't get their fingers up there, they can't break anything, right? Right, exactly. All right, so the next one on the list, I was talking about biofeedback and squeezing of the contractions. If you introduce Pitocin to try to get things moving, especially after your waters have been broken and you're on the fetal monitor, Pitocin, I've talked about this so often that it just bears repeating again. Pitocin sucks, okay? A lot of moms who are like, oh, I get a fast labor and I'm on the epidural and it's fine. They're like, oh, Pitocin worked for me. Yeah, because you were already on your way to having that baby and all it did was give it a push. Like, it's the engine, okay? Pitocin is the engine. You need to still be in the driver's seat. So if you are choosing to use Pitocin for whatever reason, you need to understand that this is the engine, okay? This is the engine that makes things go faster. But if you don't have the right direction to go in and you're just holding on for the ride, this is when Pitocin becomes the enemy. This is when Pitocin is squeezing your baby so strong, your baby cannot recover. So then they have the heart decelerations. You're now on the fetal monitor as well, because they need to monitor to make sure that that Pitocin is not going to stress your baby out. Although there are some VBAC tolerant doctors, and there are some doctors that really just like performing C-sections and would rather everybody give birth within 12 hours and they have a golf game to go to, or they want to go away for the weekend, and they're going to give Pitocin just because it will speed things up. So they'll say, you've been in labor for 12 hours and we don't see any signs of progress, so we're going to give you Pitocin. Well, maybe that's not what you need. Maybe you need to just take a rest. But because you've now agreed that, okay, Pitocin, now things are really going to ramp up. Now it's going to be more painful. Now your baby can't do the biofeedback to your uterus that says, hey, that contraction, we need to shift it, we need to turn it. Now it's just like, smack that baby out. Let's squeeze that baby. Let's get that baby out, because Pitocin has absolutely no idea what it's doing. It's just hyperstimulating your uterus. So if your baby is in a bad position, your baby is going to get stuck. If your baby happens to be like needing that extra time to recover, or you need that extra time to recover, or you've already had a previous C-section, this can also lead to uterine rupture. In fact, Pitocin was linked to uterine rupture. And this can even happen if you've never had a C-section. Pitocin hyperstimulates the uterus and squeezes and squeezes and squeezes. And some doctors are like, oh, that didn't work. The baby's still not out yet. Oh, let's crank it up another notch. Oh, let's crank it up another notch, until the baby is suddenly in distress. And then they say, you have to have a C-section. The baby's in distress now. We have to do this, and we have to do this now. There's no time for any more discussion. You tried, it didn't work, you failed. It's time to just go with plan B, which is the C-section. It's called pit to distress, and it's way more common than you would think. And oftentimes I can see this coming as well, when moms are like, you know, like, I was in labor for about 12 hours and nothing was going on. So they gave me Pitocin, and then it was really painful. So I had the epidural, but then that slowed down my contractions. And then I ended up having more Pitocin. And then they said my baby was in distress, and they said, get up, we're doing a C-section. and like my partner just had to just deal with that, and it was really jarring. Like, this literally happened to Rebecca. She was induced with Pitocin, and she ended up being told, get up, we're doing a C-section, to her partner, and she ended up with that C-section. So you really need to be careful. I cannot stress this enough. Pitocin is not something you want to mess with. In fact, I talk about this a lot in my content on my YouTube channel. Again, you can go and check out those videos where I talk about the truth of Pitocin. I'm probably going to talk about this more in the future because it really is that serious. And the thing is that we keep seeing these in the mom groups over and over, us as birth workers. It's just getting worse. There are now moms who are being pushed into an induction at 39 weeks. There are people who are always getting Pitocin. Pitocin is so common. And if you're wondering what the hell is Pitocin, I had oxytocin. No. You did not have oxytocin, okay? That may be the name that they're using for it, but it's the same damn drug. It is a synthetic version of a hormone that your body is supposed to make that gives you a biofeedback. But this synthetic version is like putting Splenda in your coffee instead of sugar. Okay? It's not the same thing. I mean, you can try to pretend all you want, but you know the difference. In comparison to sugar, imitation sugar is just not, it's not the same. So here's the thing, is that you really need to be careful. When you introduce a synthetic hormone instead of the real thing in a physiological birth, you are going to have problems. This is why if you do need interventions, you need to make a plan around that. And you need to be very, very clear on, if shit hits the fan, this is what I want. Because when you introduce Pitocin, it's a brick on a gas pedal, and you're just expecting it to take you where you want to go. And it might, or you might crash into a tree. All right. So here's another one. Being on your back. Do you see how these natural birth traps and cesarean traps kind of tie into each other? So being on your back narrows your pelvic outlet. It also is really freaking painful. It also constricts the oxygen to your baby, especially if your baby is happening to lie in a position that they don't actually like you being on your back. Another one, you're pushing uphill. So now, instead of being able to shift and move your pelvis around as you're dancing on a yoga ball, or you're leaning over on all fours, or doing whatever your body is telling you to do, you are now flat on your back. And this again ties into all the other traps I mentioned. If they break your waters, they're going to want you to be on your back, especially if after breaking your waters, they put in an internal fetal monitor. You can't walk around with an internal fetal monitor anymore. You're on your back. If they have you strapped to the electronic fetal monitor with your belly, they also don't want you to move too much, because if you're moving, you're making it so that they can't get a good reading, because those monitors are not just going to stick on. So now you're making it so that they can't get a good reading. And that's when they tell you that you need the electronic fetal monitor, like you need the internal one, because they can't get a good reading on your baby. You think this is an emergency, they can't find my baby. They're thinking, we can't get a good reading, so let's make it easier for us to get a good reading, so that we have our strip, so that we can continue to say that we did a good job. And if she needs a C-section, well, I mean, it was an emergency, we had to do it. But the fact is that by going with that fetal monitor, you're on your back, your baby's not in a good position, your baby wants to have you upright, but you can't do that. You're not in a, like, you're not able to get your baby down where they need to be in your pelvis. And then they say, oh, we need to break your water, and that will move the baby down. And now whoosh, the cord has come out. Or you've lost that cushion and you don't have that biofeedback. And then they're like, you know what? That didn't work. Let's run Pitocin. And now they're doing Pitocin. Now that is painful. And you're in the bed. You're not able to move. So then in addition to that, you're feeling this excruciating pain. And then the next thing they say is, let's get the epidural. And then the epidural leads it so that you end up being like, okay, well, now what? I can get a little bit of a break, but now my baby's in distress and now I have to have a C-section. Do you see how that works? Do you see how every time you introduce another intervention, it just leads to another one and another one and another one, how they all tie together? And you may not have all of them. It may be that just being on your back is enough to get your baby stuck. It may be that when they break your waters, that's enough. Like I almost had a C-section because they put me on my back. And I instinctively knew I did not want to be on my back. And I had the information that I did not want to be on my back. But I also didn't know how to advocate for myself. And I was scared. And in labor, you are very suggestible. And my partner did not know how to support me. And I didn't hire the right care provider at the time. I had one midwife who was going to bat for me, but the nurse that was beside her was watching her. And we were in a hospital environment that does not support physiological birth. And 90% of moms give birth on their backs. So you really have to be careful. This is why I say you need the right mindset, the right education, the right environment, the right facilitators, and the right support. Because if you don't have those things and you're on your back and you're like feeling like a turtle trying to get up, it can make or break your birth. It really can. And even if you manage to avoid a C-section, you're still pushing on your back and you're still trying to beat that clock, and it can still be an incredibly traumatic birth. I mean, this is what happened to me. I was on my back. I didn't get cut, but they basically had the control by me being on my back. So you do not want to be on your back. You want to be upright. You want to be able to move around. If you feel like you need to get on your back, just make sure you have somebody to advocate for you who can also lift you up when you want to get up off your back. Because the thing is that if you're just stuck on your back, that's when they can do things to you. Okay? So that's the next one. Finally, if you are going for a VBAC and you are trying to avoid all of these things I just talked about, it's going to be even harder because they're really thinking repeat C-section. They're not thinking in the terms of, well, you know, like birth just happens and a baby comes out of a vagina if we don't do surgery, which would make sense because if you don't do surgery, a baby comes out of a vagina. But because they've been so indoctrinated into the system and they're so scared and they see all these disasters happening, because what are they doing in maternity care is leading to these natural birth traps that lead to more cesareans, and all they see are all these disasters. They're going to try heavily to monitor your VBAC. And then at the slightest sign of trouble, they're going to give you a repeat C-section. They will be looking for every single reason possible to give you a C-section. They will be looking with a fine-tooth comb for one little tiny deviation that's going to be like, you know what, it'd probably be safer for you to just do a C-section. So we're going to really sell you on this idea that you need to do a C-section. And this can either happen before labor, and often does, where moms who are planning a VBAC suddenly decide at the last minute, you know what, it might be easier if I just do a C-section. So I'm just going to do a C-section. I've seen it. I've seen it. I've had moms come to me at the beginning of their pregnancy and they're like, you know, like, I hear that you were really good at helping moms with like avoiding these C-sections. And I've been following you for a while and I really, really want a VBAC. But then at the last minute, they decide to schedule a repeat C-section because they don't seem to be going into labor on their own, or their care provider has been really selling them on the idea of the dangers and risks that they're doing, or their care provider is like, you know, like, we're going to be really, really monitoring you, and they're just thinking, I don't want any of that. I don't want to have to feel so stressed. I don't want to have to fight the whole time I'm in labor. I don't want to have to beg for permission. I don't want to have to compromise on anything. So maybe it might be easier if I just do a C-section. This is why I say that your empowered birth will help you get the birth you want without having to fight, beg, or compromise. Because this is what I've seen with my clients over and over again, and the moms that I've helped over the last 10 years. And there's a common theme. If they don't have the right mindset going in, they don't have the right education, they don't have the right environment, they don't have the right facilitators, and they don't have the right support, if those things aren't there, or one of those things isn't there, they end up giving in. And I don't want that for you. So again, if you are attempting to have a VBAC, you need to be aware that the more cesareans that you have had, the more likely it is going to be that everybody is going to stack the odds against you. Everybody is going to tell you you can't do it. Everybody around you is going to try to scare you out of it and talk you out of it, not just before you go into labor, but even during labor. In fact, this happened to my friend Wendy, where she was going for a vaginal birth after 3 cesareans, and she showed up at the hospital, but her sister was standing outside the door, and she overheard some of the nurses saying, she's not going to be able to do it. It's going to be a C-section. And at that point, her sister came back in after having doubts for herself. She's like, I don't know if Wendy's going to be able to do this. She got pissed off, and she looked at Wendy as Wendy was about to give up. She's like, no, we're doing this. And Wendy ended up having a vaginal birth after 3 cesareans with her 4th child. And it was the most amazing, empowering experience that she'd ever had. And then that led her to working with me for about 5 years as a rally coordinator for improving birth. And then she stepped down in 2019. But the fact is that you can do this. You really can do this. You just have to recognize that it's not going to be as easy as everybody thinks it is. There is real problems in our maternity care system. There is a political game that's being played. There's also the idea of the fear around vaginal birth, around natural birth, physiological birth, birth where you're not being heavily controlled and managed the entire time. And as a VBAC mom, you have to understand that a lot of VBAC tolerant care providers want to heavily manage you. But in order to get a VBAC, you need to be aiming for a physiological birth. And then if something deviates from that, where you start to see that there might be a complication, that's when you have your backup plan. And that is what Jenny did, is that she was aiming for a completely hands-off physiological birth. She was aiming to go to the hospital and just push her baby out. And that's what she did. And the only reason she went to the hospital was because she had chronic high blood pressure and she wanted to be able to be monitored for that if something came up. But it didn't. None of the things that she was afraid of happened. She was able to have that unassisted vaginal birth after cesarean. Her doula and her partner and her caught her baby. And the nurse was standing back not knowing what the hell to do. But that's okay. Because if you can do that, if you can get your mindset strong, if you can use these 5 pillars and do what I tell you to do within Your Empowered Birth system, if you go and get that book, Your Empowered Birth, on my website, empoweringmomsbirth.com/book, I can guarantee you, you are going to have a much better chance of having a VBAC than if you never open that book, you never follow what I'm teaching you, you keep falling into these traps, and you keep following the mainstream advice that's out there that keeps telling you that VBAC is dangerous, or that, yeah, you can do it, but it's really, really hard, and you have to try to work with your care provider and compromise. You have to fight for it, and you have to beg for it. No, you don't. You don't. Because I've seen it. I've worked with my clients and I've seen it. You don't actually have to do any of that. In fact, there's a very simple way that you can have those conversations with your care provider, and even if they're uncomfortable, they don't stand in your way. And you can have those conversations with your partner about having your baby at home. Even if your partner was traumatized by your last birth and they're scared that you're going to have another C-section, you can help them to get past that. And if you have fears that come up, you can get past those. You can get that education. The education is the part that I give out the most, because that is the part you need. You need to know these traps. You need to know these mistakes that you're making, because if you're making these mistakes, that's when birth doesn't work. That's when your plan fails. That's when you start to think that maybe it was you, but it was never you. It was just the way that our system is. And this is what I'm talking about, is like, you can have your birth any way you want. You can create your birth any way you want. And you can do it even if you're older, even if you're of a higher body mass index or a lower body mass index, even if you've had cesareans, even if you have the odds stacked against you in multiple areas. Like, it doesn't matter, because your body was designed to do this. So that's what I have for you today. Thank you so much for watching. If you're loving these videos, make sure you like, share, and subscribe to the YouTube channel. And make sure you're following me on social media. Make sure you're sharing these posts, because I guarantee you there are moms out there looking for this and they aren't finding it. Because I was looking for this for 10 years and I finally was like, that's it, I'm building it, because it's not out there. I'm building it. And the other thing is that if you are loving these videos and you need some help, you can always reach out to me. Okay? So that's my gift to you again today, and I will be back next week with more cesarean traps. I'll talk to you soon.